First of all, thank you for spending time with us, and thank you for Nuvance Health for spending time with us here at AWS reInvent. Welcome. In terms of, we're going to do some quick introductions, and we're going to go into a fireside chat, leave some time for Q&A. There's no Q&A mic, so we're just going to have to repeat a question. Oh, there is a Q&A mic now. Okay. So just in terms of introductions, I'm Abbas Mouraj. I am a partner with PwC in their healthcare and cloud transformation platform. And I have the opportunity to serve health systems with data and technology transformations. Jeff?
Good afternoon. My name is Jeffrey Hook. I'm the Chief Information Officer for Nuvance Health, with the pleasure of working with Abbas, PwC, and the AWS teams.
Yeah. Hi, I'm Beth Falder. I'm the AVP of Data Management and Analytics at Nuvance Health, working with Jeff and Abbas as well.
Okay, wonderful. All right.
And there we are.
We are. All right. So Jeff, maybe we start with you and then Beth. Can we get some history on Nuvance Health, where the genesis of it, how it was created, and how did it end up today?
Sure. Glad to. Nuvance Health is about a 4-year-old health system in the Hudson Valley of New York and the western side of the state of Connecticut. In our infinite wisdom, we thought we'd form a system 1 year prior to COVID. That is not a great time to start a new business, but we brought 7 hospitals together, about 14,000 associates. I can't remember the size of our med staff, but it's relatively large. So we are relatively young. We are, I use the term fighting for relevance. We have some pretty big partners in the greater New York area, in Yale, New Haven, Hartford, those areas with some really competent and good systems. And so we came together to bring our communities care that they needed and the quality that they asked us to. And so that is how we came together in 2019.
Good. So two health systems came together a couple of years ago. What, in terms of vision, mission, and values, what sets Nuvance apart from the competition that you mentioned?
I'll start, and Beth, feel free to fill in any gaps. You know, I think in healthcare, we all look to serve our communities, make patients healthier. If you're familiar with the quadruple aim, if you're not, Google it while I'm talking. But essentially, it's better care, faster, cheaper, more convenient, and also taking care of our healthcare providers. For us, Nuvance is a play on words, new and advance. But if you're familiar with healthcare technology, you'll chuckle under your breath like I did, new and advanced healthcare and technology, ha. And so one of the things that did set us apart was that we have a great vision for our technology, starting with our CEO, starting with our board of directors. But also we looked at what are the greatest areas of mortality in our communities. And so we set up a model of institutes around heart and vascular disease, around neurosciences, and around cancer. Those are the greatest mortalities. And so we looked at how do we set up our care programs to address those mortalities, both in the ambulatory setting as well as in the inpatient setting, and creating some cross-continuum programs. That's what I see setting Nuvance apart. Beth, I think I said a whole bunch, and so I'm sorry I'm not leaving you a lot of meat on the bone.
No, it's all good. So I think one of the core things that draws a lot of people to our organization is the fact that in our mission statement, innovation is key. So we're always looking to try new things. Healthcare isn't used to failing, so introducing a concept of if you fail fast and then move forward was new to healthcare, but it's something our CEO supports, obviously with patient care at the top of mind. But with technology, we can introduce new innovation and bring better care to our communities.
Beth, talk about how different your 7 hospitals are, right? So there's one hospital in Stamford and then another hospital in Poughkeepsie, New York. Mm-hmm. Talk about the demographics. Like what's so different about, I mean, it's
yes.
Yeah.
Yeah, so we do have a number of different hospitals. We have 2 very small community hospitals, so they have under 100 beds. They're really the bedrock of those communities, and they care quite a bit about those hospitals. So they have that sense of the community ownership and partnership. Then we have some larger healthcare delivery systems, and those are more of your metropolitan area city delivery systems. And then a few in between that are mid-size, all serving the areas. As Jeff mentioned, we do have quite a competitive market as well, so that helps us bring our care up and make us think a little bit differently about what we want to do to set ourselves apart.
Abbas, if I could, one of the exciting things about our community is I am now 1 degree closer to Kevin Bacon because he lives in our community. So that's a very important point.
It's a good trivia question for later.
There you go.
All right, so let me start with a couple of softballs, and we'll get into some meat and potatoes here. But so, Chief Information Officer at a health system, right? What does a day in the life look like right now for you?
Are there any other Chief Information Officers in the room from a health system? All right. So, I see some hands kind of going up. So, okay, I can't completely make this up as I go. Chief Information Officer is somewhere between peacekeeper, visionary, and trying to keep the wheels on of an industry that has really, really thin margins. And so guess what gets cut when you can't make your margins? We can't invest in infrastructure. We can't invest in innovation. And so part of it is how do you build something and how do you do things creatively? How do you build it yourself? How do you grow your own? And then the other side is, you got to make sure that the trains stay on time. A cardiologist that can't see all his patients for the day, he's unhappy because he doesn't see his patients, and the patients are unhappy because they have care. If you've called for a specialist and can't get in, I don't know if anyone's had that problem either, but hey, the specialist can see you in 6 months. That's not acceptable. And so for me to be the cause of that, I take that very seriously. So that is the day in the life of a healthcare CIO. How do I make sure patients are getting great care? How do we set up better plans? And then how do we execute those plans? Yeah,
I think one of the sentences you said is razor thin margins, right? I mean, I don't know if we mentioned that Nuvance Health is a non-profit 501c3. Where it's different from other health systems which are for-profit, right? So I think taking the margins and doing something with it to innovate and move and leapfrog. I think that's what ultimately we'll get to it, but cloud has certainly played a role in that, right? So
absolutely.
Beth, what about you? So Chief. The chief data officer has been evolving very rapidly, especially in healthcare, over the last 3 years, I would say. How would you talk about a day in the life, and then obviously a little bit about the future of a chief data officer as well?
Absolutely, and you're not wrong. It used to be that we would monitor data for certain performance initiatives, and it was very linear reporting and not simple, but straightforward. And now we're seeing the value of data. Everyone is waking up to the fact that there are answers out there that we could find if we find the right data elements, and we really need to pull it all together. And that's from the entirety of the organization, not just one small component of it. So we field a lot of requests. We have to think carefully about what we want to proceed with. We have to think about the lens, and are we thinking holistically rather than that granular view? And how can we do things that create value to the organization, create value to our patients, and are meaningful and insightful, and not just delivering numbers or delivering an Excel sheet.
Right. What about looking forward? I mean, it's how do you manage the tactical day-to-day stuff, and then think about, value-based care coming from the CMS requirements or a President Biden moonshot. I mean, how do you manage day-to-day and then think strategically at the same time?
COVID woke us up.
Yep.
That is 100% true. So we would react to the regulatory requirements, we would react to the other asks, but we never had to react in such a tight time frame. So it forced us to think differently. We were delivering data models on a daily basis, trying to help our caregivers figure out what was going on, because we were one of the earlier hospitals to receive COVID patients. We didn't know what was happening. So data, everyone then understood the value behind that and what insights they could derive from those data models, and that caused a lot of demand. So now we're trying to streamline that demand to figure out what is important. Let's focus on those vital few and get it right, and then scale. And that's what we're trying to do today.
So I think you mentioned COVID woke us up, right? I remember when we first met, it was the middle of COVID, right? But we were working on the project long before. In fact, it's a courageous point of view that Nuvance took to embark on this, right? So how did you deal with nursing burnout, physician burnout, and stress in the middle of the pandemic, Omicron hitting the financials and the books? How did you walk us through, Jeff, how you went through this?
Yeah. The burnout is still going on. I know other industries are stressed, especially the service industry, any service industry. But you think about the number of humans that we lost. Those are people, those are employees. You look at the people who opted to just retire. Screw this, I'm out. I don't blame them. I could die doing my job. I have family to take care of. And so that took a lot of what we did with data, took a lot of what we did with technology, and said we have to scale. Now, everybody becomes an innovator because they saw something cool on Best Buy, or their iPhone did something, or there's a new app that came out. So everyone's telling you what you should do. And that's really thoughtful of folks, but really does it scale? Can you really solve a real problem? And so a lot of what we've had to look at, we know we are having a diminishing workforce with physicians, with nurses. It's not that we don't want to pay them, it's they're not there to pay. And so what that has created is that has created the need to leverage technology. Again, I don't know what industries you come from. Healthcare is 5 to 8 years behind at best. 5 years at best, probably 8 regularly in technology. So the things that I'm talking about that I'm pretty proud of, you're like, oh my God. So from some points of view, we have to look at how do we take the same technologies you're using, take the Alexa, take ambient voice monitoring, tools like that. We have to use that to simplify, get our caregivers back at bedside. And then we have things like patient privacy, data security on top of that, where I can't just whip out an Alexa and say, here, talk to the dot, or anything like that. So it's on our mind, it's on our heart, and again, it drives quality. When I don't have employed nurses, but I have traveling nurses, it reduces quality. When I don't have staff at the front office, that means we can't see you. That means you'll be sicker the next time you come in. You could be having events that are irreparable damage if we don't see you in time. And so all of this is what weighs on us. How do we use the data to make the right decision, the right investment? And then everybody looks at Beth and says, well, I need information about X. And so I think Beth has done a great job in partnership with our organization as well as with the leadership of Abbas and his team to set up governance. And so maybe, Beth, you could talk a little bit about the governance you've set up, because that's the only way that we can handle the demand outstrips the capabilities. Mm-hmm.
Absolutely. And as Jeff mentioned, the demand is great. There is so much information in healthcare. It's rich, and people are curious. We work with scientists, so they want to answer every question with data. And that's great, but we don't have the bandwidth to do it all. So we have to think a little bit differently, and the only way we're going to do that is with a proper governance structure to help us align with our organizational needs, the executive needs, the regulatory needs, the financial needs. Without their partnership, I wouldn't be able to do my job. So I meet with them regularly. We talk about the different problems. We talk through different scenarios too. So perhaps they're thinking one way, but we could solve it a different way. And the technology helps us to bring them to that place.
Do less with more.
Correct.
Does anybody else deal with fax machines in their job every day? Thank you. There's like 3 of you. Exactly.
Not e-fax, though.
Yeah. So there's nothing like saying, hey, do something with this data that got faxed to you.
Yeah.
I'll just let that sink in for a minute.
And printers.
Yeah.
Yeah.
So do less with more. How does that factor into the decision Nuvance Health took about a cloud transformation? How does cloud, a business enabler for Nuvance's strategic goals and mission?
I mentioned a supportive board and community that understood that technology can be leveraged. I have the pleasure of serving with board members from some really prestigious organizations, and they ran technology, and it's nothing like hearing a story from the Cold War when someone is doing cybersecurity through modems. Really? That happened. And so what was great is I've always been the sci-fi geek, and so I've always wanted to have that data center. I've always wanted my data to be there. I love statistics. I love analytics. I love having the answer because I know it's there. But unfortunately, the movement of data, the requisitions to archaic, very siloed industry-specific tools that run on COBOL, run on Cache, wink, wink, run on other aging systems, all my data sits in islands. And so what I realized was that we would forever be captives to other vendors if we didn't start looking at exerting our independence and moving our data to an analytic cloud. You may ask me a question about this later, so I'll try not to spoil it all, but a lot of the cloud discussions we were having in the industry was about data recovery, about moving our systems up into the cloud, storage, archiving, and that's not where we needed to go. That was moving some of our legacy costs, but how do we move our organization to compete? And moving costs into the, moving infrastructure in the cloud was nice, but I needed to have the tools that were competitive, that would be accessible, and that I could immediately get to everything I had across my 7 hospitals, 2 EMRs, dozens and dozens of other key systems. And so it was a bit of a bet to say, can we do this? Can we get it up there? And then let's start taking that data and making decisions from it, start looking at web apps, DevOps, as well as we can start to look at the archival and other opportunities. So it really was kind of my Trojan horse of analytics, thank you, Beth, to start setting the foundation for how do we compete? How do we beat these other organizations, and how do we use data faster? Yeah. I want access to AI and ML, and I appreciate all the vendors and partners that are in this room, but if one of my data scientists wants to do it better than you, I want my team to have access to those tools, and that's where we're going to go.
So Beth, I heard Jeff say modernize and leapfrog, right? I think those are the themes that I heard from Jeff. What's your take? You've been here from the start. What is your vision for cloud transformation, and where do you want to take this?
That's a big question.
It's a big question.
So we're at the early stages now. We moved from very vendor-dependent solutions to creating our own solutions. That is a great place to be, but also has its challenges because the solutions are just vast. So narrowing it down to key solutions and then thinking forward too about what makes the most sense for us. Jeff mentioned AI ML. We need to get into that space, and we need to start thinking beyond just what the data told us, but what the data should be telling us to do next. So we need to evolve to that space that helps us care for our patients. And then it also helps on the burnout side too. If you can look at a predictive analytics on your patients, when a nurse only goes into a room every 4 hours, you have other tools available to start doing some monitoring on your patients to alert you to new things. So what other tools can we give them in a predictive model to get to the patient before they decompensate? See if you're malnourished, as an example. So
I've heard the term moving from the point of care to the point of effect.
Exactly.
If you can find a sepsis patient in the ICU before they go into sepsis, yeah. Imagine that's lives saved, that's money saved to the industry and the government, right? So
one of the top causes of mortality in hospitals, and we could prevent it if we got there sooner.
Exactly. Exactly. So Beth, let me start with you on this. You're now, you said you're in the early stage, but you're in the thick of things right now. You're in the thick of it. What are some of the top considerations? What are the lessons learned so far on this journey?
So I always joke, it's not about the pretty pictures, but the pretty pictures are what sells the product. So when you show the executives what you're doing, they want to see the output, and the output is the Tableau report or the visualization or the report that they're going to receive in their email, and that's meaningful to them. But what they don't understand is the weeks it took for you to build the data models to be able to produce that, and that's the hard work, and that's the bit that really takes the most time, but it needs to take the most time so that you get it right. The worst thing you can do is build data models with the wrong information. So we're mapping that out, being very intentional about how we do that. We can't boil the ocean. You can only imagine the number of data elements just in an EMR, and then we're talking about bringing other systems in as well, and we need to make sure we do it right, and we do it so it's scalable. So rather than thinking granular about, I have this particular analyst scenario that I want to solve, I want to think about a concept, and let's talk about that concept so that we can solve not just that one, but all the future iterations too.
Yeah, Beth, I think one of the smartest things you did was have a use case based starting point. Yeah. The ingestion strategy has to be use case driven. Patient experience, or primary care. Let's get the tables in. Let's not boil. I think let's not boil the ocean, right? Let's get the tables in that we need, right?
Yeah, focus on the vital things. The others will come and we will evolve over time, but you can't do it all at once. We're a nonprofit organization, so we have to think carefully about how we use our resources. So patient experience was incredibly critical. We need to know what our patients are telling us about how we serve them so that we can improve. If we don't know, we'll just keep delivering the same way, and that's not doing anyone any favors. So that was one of the early solutions that we provided, was to give everyone immediate access to the patient experience results from the surveys that we provide in a way that they can understand it and speak to their staff so they can impact change.
Abbas, if I could, we operate from a balanced scorecard, which is a term to say not just financials drive our executive accountabilities. So patient satisfaction, quality, throughput, financials. I'm missing something here, Beth.
Value.
Value, thank you. And so from that standpoint, customer satisfaction is important. It used to be you had to go to your doctor, and whether you liked it or not, you'd accept their word. Then the internet came out, and you could start to research things. Now everybody plus WebMD equals your doctor. Congratulations. So from that standpoint, we've realized the experience is critical. We have to provide a great experience, and our CEO said we need to have a monthly program that looks at all of our scorecards. We set up a Surface Hub touchscreen in his boardroom where he could go through and review the results of each individual executive that is responsible for the scorecard and say, how are you performing? What Beth's team did then took it from that executive and worked with each individual executive to say, how does that translate down to the accountable manager and leader and frontline staff? And that's where we spent a lot of time to make sure it wasn't just people going on fishing expeditions to say, have you checked your score recently? No, here is your score specific to you. Here's how you are performing. Do you know what you need to do? And we would have weekly meetings with our CEO and every executive of the organization, and we'd sit and talk about what do we need to do to improve this. And we'd set improvement plans. Some worked wonderfully. Some were sadly optimistic, but it gave us clear lineage of data, and it brought all of it together, not just the EMR data or the financial data, but the very abstract. And now we're taking that data to look at correlations between who was on for that shift, what was the ratio, who was the attending, who is the referring. We can now look at all kinds of aspects like that. I think we found that if people pick up their phone post-discharge, We send them a call, and if we call them and say, hey, how's your experience? That give us all 5s from the car dealership. It's not like that. It's just, hey, how's the experience? How could we improve? It's not even if they give us something. If they pick up the phone, it moves our patient experience up significantly. If they don't pick up phone, then they don't. Again, I'm being semi-interactive. How many people pick up the phone for strange numbers? Me neither. And so that means we have to go to the next level of how do we deliver these same type of interactions in ways that you will interact with us, because that will result in improved patient and customer satisfaction.
It's the right message to the right patient at the right time.
Amen.
Right? The whole goal is change the behavior of the patient or the provider, right? Or the provider.
Or meet them where they're at.
Or meet them where they're at.
Meet them where they're at. And I think right now healthcare is trying to figure out how to meet people. And so you see 13,000 different text messages or emails or mailers, explanation of benefits. And it's just still a very bifurcated industry. And so we have to bring that together. And that's why bringing our data to a single point means that we can start to look at the inputs and outputs that is going to our consumers, going to our patients, even going to our caregivers.
And also, when you think about if you've ever been in a hospital, and hopefully you haven't recently, but when you're going to leave the hospital, that's when they tell you all the 1,000 things that you're supposed to do when you leave, and no one's paying attention. You're overwhelmed, you're exhausted, and you just want to go home. So having those outreach after you go home outside of our hospital walls to make sure you're okay. So it's not just about raising those scores, it's really to help you on your journey and make sure you have all the medications you need, you understand what you're supposed to do. So giving more data delivery so that people understand the types of patients that they really need to focus on to make those calls, because it's time consuming, but it's important work, and that's how we impact it.
Point.
So I think we touched on this before, but how, Jeff, coming back to you, how do you see your role as a CIO reporting, as a leader in the organization? How do you see that changing over the next 3 to 5 years, especially within healthcare?
I think it has been changing. When I entered healthcare, the CIO reported to the CFO, and then it went to the COO, sometimes the CEO of smaller organizations. I don't know that it matters so much where the CIO reports today, but I think it's about being the trusted partner, not just with, hey, here's the widgets, here's the ones and zeros, but here's where the world is going, being a student of how technology and information is driving the industry. Honestly, I work with some really smart people, and they'll tell me where technology is driving the industry. I'm like, oh, really? Am I able to take that information and turn that into an answer and solve a real problem? And so I'm expected to solve real problems. I'm expected to be a partner. I'm expected to remove roadblocks. And so kind of similar to the previous question you asked about what is the role of a CIO, it's being a little bit of everything, but we really need to be the leaders in helping the industry, or the organization digest information and the meaning out of that information. We need to also help identify what is the opportunity from that information. Where could we go next? What is the next best option or next best action? And I think that is where the CIO needs to work. I'm going to hand the mic over to Beth, because that then leads very closely to what the Chief Data Officer has been and is becoming and continues to grow in importance.
And Beth, I'm not going to ask you if you want to continue reporting to Jeff or not. So I just, no, but go ahead.
I wouldn't either.
No, so it's definitely changed, and I will say with all honesty that every day in my job is different. I don't know that I've ever had a day that worked the same way, and that's a good thing. I love that. So it's a challenge, but it's a fun challenge to have. Where the role used to be, people would come to me and ask me to produce something, and then we would output it. It's definitely evolved to, they come to us to help understand a problem, and we figure out ways to find a solution. The next iteration is going even further to get the information out there before they come to me with a problem, so then we can talk through, here's your opportunities, here's what we could do, and here's where the future holds for us. One of the best parts about my team are some of the analysts that work hand in hand with our caregivers and our delivery model. So they understand the challenges more so than I ever could, and they can speak to the problems, to create solutions, and also help our leaders understand data, because a lot of times it's overwhelming. So they need that second set of eyes to dive in there and see those opportunities and explain a little bit and evolve it.
Right. But I also credit Nuvance because they're only, and I can say this confident, there are only a handful of health systems which has now viewed data as a strategic asset, right? So as someone who's driving data and analytics and insights in the organization, right? You get to see, I tell some folks that you almost have to be quadrilingual or trilingual, where you've got to understand what's the strategic vision of the organization. You got to understand the business of healthcare, right? How to get those razor-thin margins done, and then you've got to understand the analytics, right? There are many different data systems. What is sometimes blood sugar versus A1C is different in every system, right? How do you manage the data quality and the data management side of things? How do you manage the analytics? And then how do you drive the technology pieces of it, right? So there's so many things to keep track of. Talk us through how, what your vision is to put all those things together to drive change.
Still working on it.
Still working on it. Okay, fair enough.
But we're getting there. Yeah. So it's knowing the right questions to ask and bringing it together in a way that people understand. They're going to come to you with 1,000,001 problems, and the truth be told, what they're coming to you asking for isn't really what they want. So you have to keep diving in there to understand what truly is behind the scenes of what they're asking for. And knowing the business, knowing the industry, knowing the regulation behind it all does help tremendously, which is where the analysts come into play quite a bit.
God.
Yeah.
The other side of it is the chief data officer needs to be a trusted partner, and I think that's one of the aspects here. As you go through whatever programs you're doing or seek to facilitate, there is a validation process that you have to do, and you have to earn the trust of everybody you're working with. If you surprise anyone, you failed. And I think Beth said it nicely. Usually what Beth does is walk executives off a cliff and say the data is accurate, you're okay. What you had been looking at was inaccurate or had been distorted by the 300 different machinations that took place prior. And so back to that quadrilingual, you have to be a little bit of counselor.
And grief counselor is definitely
grief counselor, absolutely. So that is part of the process, but I think the effort to move things into a cloud from healthcare, the value is you have to strip back all the proprietary rules, you have to strip back all of everyone's historical bias, and you have to look at the data for what it is. And that is where the chief data officer has to walk that process, earn that trust, and if you fib for a moment, you're done.
Yeah, agreed. So Jeff, coming back to the cloud transformation that you're at the early stages of, I mean, there are only a handful of health systems which have done what you've done, and in an incredibly fast time. I mean, I think we started the build in January. I mean, you're putting PHI and PII into the cloud. What helps you sleep at night there? I mean, given the rapid amount of health systems that are having issues these days, unnamed, of course, but
unnamed.
Yeah.
Well, we have a mantra. Starting with the CEO. The CEO says, "Hook, I don't look good in orange, so make sure we're safe." I tell my CISO, "I don't look good in orange, make sure we're safe." And that is very important that our PII, PHI is very secure. We have a very robust team, very robust program. But being in the chair that I'm in, I get to see lots of instances where healthcare has been taken over by ransomware, or there is a information breach or a loss of PHI. And what I found was, for those that I've experienced, I don't know if there's any wood here, but I'll knock on it, those that I've experienced has been the vendor misconfiguration. And so anytime someone says the cloud is scary, I said, no, the people running that software in the cloud is scary. And so the very first thing I said was, I don't know cloud infrastructure, but if we're going to do this, we have to have it right. And so we set out and put together multiple work streams, one on infrastructure, one on data ingestion, but one focused primarily on data security. And it's actually become a jumping off point for our zero trust philosophy as we're working towards a high trust certification at our organization. So that's a whole bunch of jargon to say I'm really darn proud of what we've done, how we've done it. We've got a long ways to go, and it's a never-ending battle. And by God, I don't want to paint a target on us. I do not want that. But really, that is my biggest concern, and it's really been who is handling my data. So we've spent a lot of time and energy focusing, hiring staff to focus on this only as a security engineer. So we've put the effort in. We want to make sure it's secure. And again, I want to be industry agnostic. I want to bring staff from any industry. And so that's part of the excitement too, is I don't have to have a healthcare specialist. I need a security specialist. Can you pick up on some of the best practices for us? So I take it very seriously. I don't look good in orange. And honestly, it's also, I'm sure all of you gotten some type of, hey, your information got lost, whoops, sorry. You feel violated. And to know that, your mammography, your most sensitive data got out there and somebody has it and they know all about you, doesn't feel good. And so that's, again, the very personal mission that I have about keeping it safe. And so we've clearly, I'm a little bit fired up about that. But yeah, this is a big deal for us, and it's been vendors and it's been the owners of the data that make mistakes, and we're going to have many eyes on it to avoid mistakes. If we make one, we're going to make it right and continue to improve.
So I shouldn't get you an orange jumpsuit for Halloween next year?
Bring me a box to pack up my office too.
So there's so much going on in healthcare right now. As I mentioned, Omicron sort of crushed financials this year for most health systems. There's a massive behavioral health epidemic going on right now, right? And post-COVID, there's, as we speak, there's sort of a trifecta of COVID and RSV and the flu all resurging. Healthcare, even though it's a highly regulated industry, it changes, right? CMS could come out with something tomorrow that could affect us, right? How does this project sort of align and to the best of your ability with sort of, Beth, where the industry is going? Let me start with you.
So, like I said, COVID woke us all up, and now we're having massive surges in our ERs because patients are getting the flu and getting other illnesses that they perhaps didn't get because they were masked up and isolating, and now we're back in the open and people's immune systems are down. So we need to be able to map out a patient's journey. Technology helps us to map out that journey so then we can get them at the right place at the right time and not linger in our ERs or not linger in a holding area. We can get the results to them quicker. We can bring information to the caregivers quicker so they can care for those patients faster. Bring information to our primary care doctors, so let's not even get to the hospital. Let's care from them where they're at, and that's that whole population's health strategy as well. So trying to get as much information as we can out there, but we also have the creed, don't be creepy. So we don't want to overwhelm patients because we have all this information, but sometimes it feels a little creepy. So walking that fine line, but making sure if you're going to your cardiologist and you have elevated blood pressure, we want to make sure your primary care doctor knows, so long as you approve that, of course. But what else can we do to help you care for yourself? And technology brings it all together for us.
And I'll pick up from there. I think one of the things we saw through COVID is state governments are not prepared to actually handle this data and do anything with it. And I mean that lovingly, maybe not, but they're not prepared. And so state governments were asking data, not knowing what to do with it. The federal government was saying, send us data, but we don't know what to do with it. We got into debates on whether it's trusted or not, turned into a political issue. And so from a macro standpoint, the way I see this program is we now have the capability, we have the aggregation of all elements in one place that I can then beam to 2 states, 3 states, 4 states. I'm in the tri-state area, so I have patients in New Jersey, New York, Connecticut, Massachusetts. And so from that standpoint, if any of those states require something of me, it changed for every single state. The federal government wanted certain data, and having 2 EMRs, 2 registration systems, you just go through all that. The moving of the data was the biggest pain, and then you have to normalize it. We're now to a single point, and again, it's not too different from an enterprise data warehouse, but to have it all together and already have it in play, I can move it to anyone quickly without lifting, shifting, or dealing with proprietary. And so those are the areas that I see this benefiting us as we go forward. This is going to help us answer the needs of the federal government and the state governments quicker, and hopefully using less resources, because I spend an exorbitant amount of time and money just meeting the requests of regulators. And that's it really sucks to know that I'm wasting patient care, time, and energy just to answer a question of a politician.
But also, just to feed on that, having that data and information also lets you see when pockets of things are happening. So if you have one geographical area where you see patient volume going up because they have the flu, you can kind of map it out to say maybe we need to start staffing differently in those areas too. So bringing it all together, having it at our fingertips lets you develop the models needed to deliver care at the right time.
Have you seen how Beth is my optimist and I am the...
Realist.
Thank you, realist.
But what I'm hearing, Beth, is flexibility.
Absolutely.
Right? This project has given Nuvance flexibility to pivot, right? And in the business world, I mean, you know, Jeff, you started the conversation with, well, healthcare is 5-8 years behind. I don't disagree, but other organizations are still trying to get to the ability to pivot, to be able to flexible, and you're there, right? So it's as you said, like land and sort of expand. What's next for this, right? So, So Jeff, let me ask you the question here, and everyone's smiling here. But why PwC? I mean, why there's so many other good, partners out there?
I will answer this honestly and transparently. I spoke with many other partners and honestly had stronger relationships with some other partners prior to my discussion with PwC. I was not interested, as I mentioned earlier, I was not interested in a cloud journey for archival or hosting of systems. I didn't want to, that's not accretive for my organization. What I was looking for is something that was transformative, that had the vision of analytics, data, but also when I start getting that data and those insights, can I bring that back into actionable information? Can I bring that back into the EMR? And that was actually one of the things that I found during COVID. I'm going to take a little aside, but during COVID, every single telemedicine platform failed. Every single one. So guess what we did? Hey, Zoom's working. Let's use Zoom. And so my team literally built with APIs and brought Zoom and its APIs into the EMR to say the patient's ready to see you, the physician's ready. We had messages going back and forth. And that moment was where the light bulb turned on of, I can bring anything into the EMR and tell my physician, tell my caregiver, my environmental services person, I can give them messages about what's going on. It doesn't have to be just about EMR data. It could be about Zoom. It could be about HR information. It could be anything. And that was my vision or my excitement about the cloud that I knew was possible, but I didn't know how to make happen because I had to run the day-to-day. And so what set PwC apart was Abbas, in your discussion, having the same vision, the same excitement for those things, rather than talking to you about archival and remote hosting, cloud hosting. That's boring. That doesn't solve healthcare problems. That just solves some bottom line problems, maybe. And so what set you apart, Abbas, I'll compliment you, and a couple people can pat you on the back for this, was you were equally as excited about what I was excited about, as well as you're like, I think we can do this. So let's do it. We have, and now it's time to start to realize the value of that flexibility. So that is, I think for whatever vendor, whatever partner, whether it's PwC or anyone else, if your vision aligns with the decision maker and it matches the organization's vision that you're meeting with, you're in. It doesn't have to be the sponsor of this discussion, but it's perfect when visions align and you want to leapfrog and you want to innovate and you want to do better for your community.
Jeff, thank you for the kind words, first of all. Beth, anything else to add?
Absolutely. So I think one of the things for me is that I have a team of primarily SQL programmers. So this is all new and it's overwhelming, but working with PwC, it's given us cloud with guide rails. So they've helped us to establish the environment. They've taught us how to do these things. We've been able to evolve our skills. So having that partnership, having that flexibility to do it side by side so then we can take it over. What we didn't want is to work with a vendor who was going to deliver a solution in the background and then, oh, here you go, because we wouldn't know what to do. But this is our combined solution, and when PwC does go, we'll have the confidence to move forward. So allowing that learning opportunity was huge, and the partnership.
I mean, right back at you. I mean, Beth, your team, has scaled and grown and learned, and just it's amazing to see that, right? And Jeff, I was as excited to meet a leader as I mentioned. There are only a handful of systems that have looked at data as a strategic asset, and let's just say it was a great experience working with you over the last couple of years. So. All right, I think we're out of time, but I just wanted to thank Jeff Hook and Beth Falder for their time here, and thank all of you.
Thank you very much.
For this time. Truly appreciate it. Thank you, and have a wonderful conference.
Thank you.